The Human Sciences Research Council has been looking into lived experiences, challenges and vulnerabilities faced by healthcare personnel and their families, as well as psychosocial support services that have been available to them. We're joined now by the HSRC's Deputy Executive Director of Human and Social Capabilities, Professor Priscilla Reddy. Professor Reddy, good evening to you and thanks for your time. You know, as we were coming into this pandemic, we had a lot of conversations about how the additional workload, how seeing, people die without their families was taking a mental strain on healthcare professionals. We've had some time pass and, perhaps just for a bit of background, the study that you have been conducted, what in particular have you been looking at?
Good evening, Kathy, and good evening to the viewers as well. Kathy, again, thanks for inviting the HSRC and myself to this program. Yes, as you know, last year we did a very large quantitative survey across the country, nationally representative, trying to understand where healthcare workers were at. And at that time, we could see that nurses in particular were taking a lot of strain, and they felt that their mental health issues had not been covered well enough. So we're a year later now, and we wanted to do a similar study, but we created a reference group or an advisory group of healthcare representatives from the various healthcare organizations in South Africa, and they recommended that we should do this qualitatively, which we thought was a great idea and a thoughtful idea, because what we're going to do with the study that starts tomorrow is we're going to do in-depth interviews with a selected number of healthcare workers who are passively selected. So the entire work is qualitative. We want to know, what has COVID done to them as human beings? They've been at the absolute front line. They've had so much research done in their environments, on the patients, amongst their families. Where are they at? And that's what the study is setting out to be. Where are they mentally? Where are they physically? How are they feeling? Because they're one group of people who have essentially been the unretiring soldiers. They've worked continuously. And additionally, many of them indicated in the first study that they had lost close colleagues beside family members as well. So that's the aim of the study.
Which are the provinces in which you'll be conducting the study, and any particular reason for the choice of locations?
Yes, Kathy, that's a good question. We're going to do the study in the Western Cape, KwaZulu-Natal and Gauteng, finances being one reason. But the other reason are these provinces have been the hardest hit provinces in wave 1, wave 2, wave 3. And just overall, these provinces saw the burden of COVID cases, COVID deaths, and the number of healthcare workers who've already passed away in these areas. We're also going to make sure that in these provinces, we will try and recruit rural healthcare workers and look at what their experiences were. So it's a very in-depth study. We were also using something that we call the serial interviewing, where because we know that some of these things are very painful and very deep and affected healthcare workers and society at large in different ways, we may have to go back to people to explore further what it is that they were saying in telling their story to our interviewers. So, yeah, it'll finish at the end of August, mid-September. So we're planning to spend a lot of time. But, we're not going to stop there, Kathy. What's going to happen is once we find this information and we do some analysis on it, we will then be planning a quantitative study across the country again.
One of the things that has been complained about, in particular by organizations that represent health professionals, is that there hasn't been adequate support, at least monetary support for workers during this time, that, these health professionals are having to spend a lot more money to take care of their own families, make sure that they're better protected against COVID-19, and yet there doesn't seem to be any recognition of these additional costs that are coming out of the pockets of these workers. Are you going to be looking at that at all?
Yes, we have a band of questions where we will talk to them about the economic consequences. You know, we've all been talking about mental health consequences, and many health workers in particular, I don't have numbers right now, but perhaps in the next interview I'll have numbers, are women. And women are often heads of households as well. So any economic impact that it's had would have technically affected women disproportionately. So we will be asking them about the economic issues, the economic determinants and subdeterminants of how it's affected them and how it's affected their ability to care for children, to care for grandparents who are living with them and other family members. That's an important part. We'll also be asking them about their transport, their physical environments where they work. We'll ask them about what kind of support perhaps they've given each other, if any support, because in the first study it was very clear that the support to healthcare workers were very limited. And I think another component that we'll be asking them about in fair amount of detail is the loss of colleagues and the impact that has had on them, because it's the loss of colleagues, but it's in a different environment. It's in an environment of fear, of where your patients are dying, family members are dying, friends are dying, and the whole atmosphere, in the last year has been quite scary for the general public. And I hate to think what it feels like for healthcare workers going in and out on a daily basis, committed to the lives of the patients, and putting themselves at risk in a sense. And we know that in the early days, healthcare workers had major issues with PPEs. We did ask about that in the quantitative study. In the qualitative study, we'll delve more into that as well.
Professor Priscilla Reddy from the Human Sciences Research Council, thanks for your time tonight, and we'll certainly be keeping a look out then for that study once its work has been completed.